Welcome to GPAT to NIPER Notes channel. So in this we studied we have to study pharmacology classification. So in pharmacology, whoever's in final year and preparing for GPAT, who might be completed their pharmacology study, so they might use reference books such as K.D. Tripathi, Garg and Gupta, Reng and Dale, and etc. So, in pharmacology, main important thing is to study pharmacology classification from ANS to anti-cancer. So, it should be by heart, by classification. So, today we are going to discuss about first classification, ANS, autonomic nervous system. So, see, drugs acting on autonomic nervous system. So, first we look at the classification, cholinergic drug, cholinomimetic, parasympathomimetic. Whatever the parasympathomimetic is there, which is arises from craniosacral nerve, means cranial nerve and sacral nerve. Cranial nerve is 3, 7, 9 and 10, and sacral nerve is arising from 2, 3 and 4. And simultaneously means vitamin K dependent factor is of 2, 7, 9 and 10. So first is cholinergic agonist, direct acting, choline ester, acetylcholine, methacholine. Methacholine is beta-methyl acetylcholine, carbachol act on both, and bithanacol EM3 means which act on EM3 receptor. Then alkaloid, muscarine, pilocarpine, ericholine, nicotine. Pilocarpine consists of two ring tetrahydrofuran means lactone and imidazole. Then in anticholinesterase, reversible carbamate, physostigmine means iserine, neostigmine, pyridostigmine, idrophonium, rivastigmine, donepezil, galantamine. Then in physostigmine, which is a combination of indole plus pyrrolidine. In acridine, which is a 9-amino acridine, and drug is tacrin, which is a sorry. Then second in anticholinesterase is irreversible. Carbamate, carbaryl means Sabin, Provoxer, Begon, Aldicarb. Organophosphate, diphlose, icothiopate, malathion, diazinon means TIC20, tabun, sarin, soman. Then see, if you look here is what adrenaline is a physiological antagonist of histamine and acetylcholine. Then father of pharmacology is who? Oswald Smithberg. Then here we look means we study first that vitamin K dependent factor is 2, 7, 9, 10, and parasympathomimetic is arising from craniosacral. Cranial nerve is okay, we studied already. Then important is what? Nicotine. Nicotine is a combination of pyridine plus piperidine. Pilocarpine is a combination of tetrahydrofuran plus imidazole. And okay, then C. Physostigmine is antidote for atropine poisoning. Then hydrophonium test. You know that hydrophonium is used for diagnosis of myasthenia gravis and cholinergic crisis, except these all are ester of carbamic acid, and which is also known as tensilon test. Then icothiopate is a mercaptoethyl derivative. Then okay, all organophosphate are lipid soluble except icothiopate. So this is important. Then anticholinergic drug, muscarinic antagonist, atropinic drug, parasympatholytic. First is natural alkaloid, atropine, hyoscine, scopolamine. Semi-synthetic derivative, atropine methonitrate, homoatropine, hyoscine, butyl bromide, ipratropium bromide, tiotropium bromide. Synthetic compound, mydriatic, cyclopentolate, tropicamide. Vasoselective, oxybutynin, flavoxate, tolterodine. Antiparkinsonian, trihexyphenidyl means benzexol, procyclidine, piperidine. Then anti-secretory, antispasmodic, quaternary compound, propanthelin, oxyphenonium, clidinium, pipanzolate, methylbromide, isopropamide, glycopyrrolate. Tertiary amine, dicyclomine, valethamate, pyrenzepine, tilenzepine. Then C. There is epoxy bridge. Epoxy bridge is present in hyoscine, which is also known as scopolamine. Then atropine. Atropine is what? DL-hyoscine. L-hyoscine is scopolamine. Then both have tropic acid, so only difference is that in atropine there is a tropin base and in hyoscine there is a scopin base. So see, this is important. Then atropine is a potent mydriatic and slow long lasting action. Hyoscine is used in motion sickness. Also hyoscine means scopolamine, which is used in lie detector, which is a longer acting than atropine. Narcoanalysis, which is used in narcoanalysis, that is lie detector, then which is a reversible antagonist at EM receptor. So this should be easy. Then atropine is an antidote for anti-acetylcholinesterase and early mushroom poisoning. Then if you look below, then there is a propanthyline and methanthyline, which is a xanthine derivative. So this should be E. So this should be clear. Then propanthyline is used in peptic ulcer and gastritis. Clidinium is used in irritable bowel syndrome. Glycopyrrolate, not cross BBB, which has a pyrrolidine derivative. Then glycopyrrolate is a pre-anesthetic medication and used in during anesthesia. Botulinum toxic mimics anticholinergic, so this should be important. Trotivirine, it is a smooth muscle antispasmodic acting by non-anticholinergic mechanism. Then pyrenzepine and telinzepine block M1 muscarinic receptor. And in mydriatic, tropicamide, which is the shortest acting drug, and which are amino amide. Vasoselective, which is a M3 antagonist. Tolterodine, then okay, direfenacin, solifenacin is the longest acting. Then here is a antiparkinsonin, which is amino alcohol, means trixaphenidyl is amino alcohol. There is a benzexol. Then homoatropine is a combination of tropin plus mandelic acid. Then if you look here is that cholinergic causes active meiosis, anti-adrenergic causes passive meiosis, anticholinergic causes passive mydriasis, and adrenergic causes passive meiosis. Then C, parasympathetic, which causes easy urination, excretion, and diarrhea. Sympathetic, beta-2 urinary retention, ejaculation, constipation. What is potency? Definition of potency is amount of drug required to produce desired effect. Efficacy, ability to produce desired effect. Then what is the formula for therapeutic index? Therapeutic index is equal to LD50 upon ED50, which is equal to maximum safe concentration upon maximum effective concentration. Then margin of safety, LD1 upon ED99. Then which is remember by this trick, TILE. TI for therapeutic index, L for this L lethal dose, and E for effective dose. So this should be understand from this short trick. Then we know that from in NMR, which is the important formula, HID is equal to C minus H upon 2 minus X by 2 plus N by 2 plus 1, and this MCQ has asked in GPAT 2021. So this should be clear. Then BMR unit is calorie per hour meter square, which is a BMR is a basal metabolic rate. Then AOC is equal to dose upon total body clearance. Myopia, what is myopia? Myopia is a far object blurring, means nearsighted, and hypermetropia, which is a near object blurring, farsighted. Circular muscle means parasympathetic nerve act on circular muscle and sympathetic nerve act on radial muscle. So this make this the mechanism of mydriasis meiosis short. This should be clear from this. Then atropine causes tachycardia, mydriasis, hyperthermia, reduced secretion, that is dry mouth, bronchial dilation, constipation, and urinary retention. Then physostigmine is an antidote for atropine poisoning, and atropine poisoning is also known as belladonna poisoning. Neostigmine, antidote for non-depolarizing neuromuscular blocking drug like tibocurarine. Anticurare action, which is used in treatment of myasthenia gravis, hydrophonium is used. Then see above, pale pink man syndrome is shown by which drug? Hexamethonium. Red man syndrome, which drug? Vancomycin. Blue man syndrome, amiodarone. Grey baby syndrome, chloramphenicol. And this should be new, floppy baby syndrome, which is shown by benzodiazepine. Then this is included in biochemistry. See, type of inhibitor, there are 4 types: reversible uncompetitive, reversible competitive, reversible non-competitive, and irreversible. So Km and Vmax. Reversible uncompetitive, decrease. Then reversible competitive, increase no effect. Reversible non-competitive, no effect, decrease. and irreversible no effect decrease. Here important thing is that see, reversible and competitive inhibitor binds to enzyme substrate complex, and here reversible non-competitive inhibits binds to enzyme as well as enzyme substrate complex. So there should be difference, means see, non-competitive and irreversible are same, means what, no effect decrease. First is Km and second one is Vmax, and there in uncompetitive both are decrease, and competitive Km is increase and Vmax is no effect. Then when Km is low, strong affinity between enzyme and substrate. When Km is high, weak affinity between enzyme and substrate. So it should be opposite. And when Km is greater than substrate concentration, enzymatic reaction is first order. And when Km is less than substrate concentration, then enzymatic reaction order is zero order. Atropine poisoning is also known as belladonna poisoning. Antidote is physostigmine. Physostigmine poisoning is also known as mushroom poisoning, and antidote is atropine. Torsion angle, which is included in medicinal chemistry, what, 74 degree, this should be important. Then torsion angle shown by which group, O1 C5 C4 En, and this should be numbering is from here, their structure. Okay, then next is bupropion. Bupropion is an antidepressant, ganglionic stimulant, selective nicotinic agonist, nicotine small dose, lobeline, dimethylphenylpiperazinium DMPP, NN agonist, tetramethylammonium TMA, varenicline, partial agonist of alpha 4 beta 2 nicotine receptor, non-selective muscarinic agonist, acetylcholine carbachol pilocarpine, anticholinesterase MCN343A agonist at M1 receptor, competitive blocker, ganglionic blocking agent, which include first competitive blocker, which is also known as non-depolarizing blocker, quaternary ammonium compound, severe hypertension, see hexamethonium pentolinium. Pentolinium is a bis quaternary nitrogen, and hexamethonium is an antidote for nicotine poisoning. Amine, mecamylamine, which is a secondary amine, and pemphylline, which is a tertiary amine. And mecamylamine is used as a ganglion blocker, used for smoking cessation. Monosulfoname compound, trimethylphencamphor sulfonate, antidote for nicotine poisoning. Persistent depolarizing blocker, nicotine large dose, anticholinesterase large dose. Thank you. So see, if you look at the small book of pharmacological classification by K.D. Tripathi, so classification is there, but for means in pharmacology classification is important, so you read it daily on daily basis, so you will be remember you, and classification based are question are asked in GPAT as well as in NIPER, so this should be helpful. Revise daily. If not possible, then listen this audio. This should be helpful to you. Share this video with your friends, so this also help for them. And in upcoming days, all classification video are uploaded on this YouTube channel. So subscribe this channel and press on notification button, so you will get notification when video is uploaded. Okay, thank you.